What to do if there's blood in your cat's stool? If your cat uses litter box, you have probably become familiar with the way his stool normally looks. It can be concerning to suddenly see blood in your cat's stool. Is it cause for alarm? When should you bring your cat to the vet for blood stool? There are a few reasons why you see blood in cat's poop. Some are more serious than others. Number 1. Diarrhea. Diarrhea can cause irritation of the lining of the lower gastrointestinal tract. If your cat has diarrhea or soft stools, they may start to appear bloody after a few days. Number 2. Constipation. Constipation often makes a cat strain to defecate. This sometimes leads to ruptured blood vessels in the lower gastrointestinal tract. The stool often appears hard and small, and may have blood on the outside. Both diarrhea and constipation can be caused by stress, dietary changes or intolerance, parasites, foreign bodies, infections, toxin exposure, inflammatory bowel disease, and many other illnesses. Dehydration can cause constipation in cats. On the other hand, diarrhea often leads to dehydration. In addition, a condition called MEGACOLON causes constipation in cats. Growths like polyps, cysts, and tumors can cause blood in the stool. Watch for dark-colored stools which look tarry or resemble like coffee grounds. This may not look like blood at first because it is so dark in color. That's because it is digested or partially digested blood. The presence of dark blood in stools means there is bleeding somewhere in the gastrointestinal tract, like the small intestine or stomach. If you see droplets of blood in the litter and on the sides of the box, don't assume it's from the stool. Blood can also be present in the urine, especially when urinary tract infection is present. So what to do if your cat has bloody stool? If your cat's poop has been normal and you see some blood one time, watch your cat closely for a day or two. If your cat shows any signs of illness or you see blood again the next day, then it is time to visit your vet. If your cat has not had a bowel movement in a couple of days, you should also contact your vet. Make sure you follow your vet's advice for routine parasite screening. This is usually recommended about once a year but should be done more often if your cat has abnormal stools. This is especially important if your cat goes outdoors. Your vet may also recommend lab tests to look for problems with the blood cells, organ function and urinary tract. Abdominal X-rays may also be needed to look for foreign bodies, growths, or structural abnormalities. An ultrasound may also be recommended to get a better look at the abdomen. The treatment for bloody stools generally depends on the actual cause of the blood. There are gastrointestinal support medications and supplements that your vet may recommend if acute illness is not found. This may include the use of probiotics, and a diet change may also be necessary. If you like the content of this video, please don't forget to like, share and subscribe. Thank you for watching.